Hey, Dave O'Sullivan here, and in this short video I want to show you how to help your patients navigate their day-to-day lives without restrictions. Now, the first thing that we need to happen in order to do that is we need to do a great subjective assessment, okay? So with subjective assessments, obviously we need to rule out red flags, okay? Nothing sinister, nothing serious. We also need a solid injury history and a clear timeline. But then what we need to do in order to help our patients navigate day-to-day life is we need to understand what they do on a day-to-day basis. Okay, so before we even get into the objective assessment, we need to have this mapped out. And we need to understand, okay, this is what you need to be able to do on a daily basis, and this is what you want to be able to do. So then once we have that information in the subjective assessment, you're going to go into the objective assessment completely focused on helping that patient. What usually happens, and again, I say this with respect because this is me starting out, we fly through the subjective assessment, we go through the objective assessment, we quickly tell the patient something, we start with hands-on treatment. Whereas if you take the time to get some structure in your approach, map out where the patient wants to get back to before you've even done the objective assessment, now rather than just using a generic objective assessment, the objective assessment is going to be meaningful because now what I can do is I can actually assess all of these milestones, okay, and how they're currently doing these if it's safe to expose the patient to that. Once we understand where the patient is now, okay, at point A, then we can really understand the gap of what needs to happen in order to get them to be able to do these things without having a pain experience and moving with confidence. So we get zeroed in, okay, we get zoomed in on the objective assessment of what they need to do. And then guess what happens with the hands-on treatment, okay? We get zoomed in also on the tissues that are going to contribute towards helping that patient do these tasks with, as Louis Gifford says, thoughtless, fearless movement, okay? And when we're designing the rehab plan, guess what the rehab plan is going to be? It's going to be those exercises, and we're going to really focus on helping the patient be successful with these things. So we're going to move away from just giving generic strengthening exercises, and we're going to become laser focused on actually what the patient needs and wants to be able to do. And the biggest mistake that people make is that they really disrespect the subjective assessment, because the subjective assessment is where we really structure everything. Okay, we structure what the patient's story is, and then we structure where we're going. And then we move into the objective assessment with a complete different level of clarity and a complete different level of focus. Now, if you want more structure and you want a step-by-step system to help even the most complex cases, just pop a comment, say yes please below in the comments, and I'll get some information over to you, or feel free to message me privately if you want to. We've helped over 900 therapists in over 30 countries. We've worked with therapists in varieties of environments. I'm sure we can help you too if you are a good fit for this program. So if you want more information, just pop below yes please, and I'll send you all the details